We will talk about dry mouth or xerostomia. It's a common condition. Dry mouth affects around 15% of world population. And how people describe dry mouth? They say that they have parched or having cotton mouth, or soreness or burning sensation, or difficulty swallowing or difficulty speaking. So even objectively, person does not have dry mouth, and saliva formation and saliva production is normal if person have sense that and feeling that he has dry mouth is dry mouth. Now let's say, what are the most common causes of dry mouth? First and most important and most common is medications. Antidepressants, allergy medications such as antihistamines, decongestants to intake for nasal congestion, or diuretics. So lots of medication can cause dry mouth, and at this case what we can do first is that you should try to switch medication, alternative medication which has no such side effect but same effect or same action. Of course, you should consult to your doctor at this case to find such medication which is optimal and does not have such side effects like dry mouth. Also, sometimes adjust dosage is important also, because lower dosage from dry mouth can be resolved. If there is no such solutions, then saliva stimulants are used, such as pilocarpine is commonly used, and person can intake lozenges also, or sugar-free gums also. They are effective, especially if they contain xylitol. They stimulate saliva production, so gums and lozenges are important. And person should drink around 10 glasses of water when person has dry mouth. Second most common cause is dehydration. Dehydration is very common, especially if there is hot environment outside, if person is exercising intensively, and if person is sweating. Such cases, solution is hydration, of course, and drinking water and all other fluids. Third most common cause is Sjögren syndrome. Sjögren syndrome is autoimmune disease. It's interesting disease. Most commonly it affects women. 90% of cases of Sjögren syndrome affects women after age of 40. What it means? It's autoimmune disease. It causes dry eyes, and eyes are red. Eye redness is common. They have dry mouth, they have dry skin, and they have less sweat, they sweating less, they have vaginal dryness, and they have increased risk of lymphoma by 40 times. It's important because if person has Sjögren syndrome, he has importantly increased risk of lymphoma. What is the solution at this case? Solution is artificial tear and artificial saliva. So we have no direct treatment of Sjögren syndrome, we have only symptomatic management. Fourth most common cause of dry mouth is mouth breathing. Dry mouth during mouth breathing can be caused by different conditions, like common cold, for example, or flu. For example, after flu, almost 50% of people has dry mouth. Also after common cold. Also during nasal congestion. And it can be just habitual. Person can be already adapted mouth breathing, and such person will have dry mouth, of course. Alcohol, caffeine, and tobacco increase risk of dry mouth. They can exacerbate and they can cause also dry mouth, so you should be careful. And diabetes is important also. Diabetes mellitus causes dry mouth, because when blood glucose level is increased, it causes drought from fluid, from tissues to blood, and from blood to kidneys, and from kidneys it is excreted as a urine. So we're losing fluid, we're losing water when we have diabetes. That's why we have frequent urination, we have increased thirstiness, because of we're losing water, we're losing fluids, and we have dry mouth, and we have increased hunger. That's a important triad of diabetes: increased hunger, increased thirst, increased urination. And the dry mouth is also important symptom. It is represented in 50% of cases in people who has diabetes, so it's important. Also, radiation therapy because of cancers, because of neck and head cancers. Radiation therapy also causes dry mouth because it kills salivary glands and causes inflammation of salivary glands. Also, radioiodine therapy increases risk of dry mouth because it also affects and cause death of many salivary glands, and sometimes it's permanent and it causes chronic dry mouth. Drinking around 10 glasses of water is important. It's very important. Limit intake of sugary drinks, sugary foods, alcohol. Sugar-free lozenges and chewing sugar-free gums are important also, and it's preferable if they contain xylitol, and using saliva substitutes if dry mouth is very pronounced and severe. That's all I wanted to say. Thank you for your interest, thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.